knowing the cancer, preventing cancer, fighting cancer. Roughly 40% of cancer cases could be prevented. What is your advice to both the lifestyle and also the mental adjustment of a person who has been newly diagnosed?
The first piece of advice I would give is that cancer doesn't define a person. You're still the same person you were prior to your cancer diagnosis, and never forget that.
Hello everyone and welcome to Health Talk on CGTN. I'm Li Dongning. Well, today we are very honored to have with us a cancer specialist, Professor Mikkael Sekeres, with us to talk about how to prevent and fight cancer scientifically. That's the key word. Well, welcome to CGTN, Professor Sekeres. Nice talking to you.
Thank you so much. What a privilege it is to be here.
How about we start our conversation by the very definition of cancer? So what exactly is cancer in simple terms? Why do some of our healthy cells turn against us all of a sudden and go rogue?
Cancer, at a very basic level, is the uncontrolled growth of cells. Across our lifetime, our cells grow when we start as a baby and then become adults. Of course, that's the most obvious example. We get bigger because our cells grow. But as adults, our cells also grow and replace themselves. And that's a normal process of cell aging, death, and rebirth. But when cells grow and grow and grow in an uncontrolled fashion and ignore the normal body signals to stop growing, that's the definition of cancer.
The bad news is that cancer is on the rise globally. I read from IARC reports by 2050, we would see over 35 million new cancer cases each year, almost doubling the number in 2022. What do you think is driving the surge?
And I think there are a number of factors leading to the increased rates of cancer diagnoses worldwide. First of all, people are exposed to a lot of different things in their environment. That could be things like pollution. It could be things we're exposed to in our diets. There's more of an obesity epidemic, for example, in more developed nations. That's also a risk factor for things like cancer. It could be environmental exposures like smoking or drinking alcohol. Or the increased rates can also be related to how we define cancer. As we're making diagnoses earlier and earlier and our definitions of cancer have expanded, we're increasing the rates of cancer simply because we're diagnosing more things that we're calling cancer and we're diagnosing it at earlier stages.
You've mentioned before that roughly 40% of cancer cases could be prevented through healthier lifestyle. So what do you think are the most crucial factors in terms of people's lifestyle in preventing cancer?
Well, the absolute top thing that people can do to help prevent the development of cancer, something that is to not smoke, and if people do smoke, to stop smoking. The bad news is that smoking is related to a dozen different types of cancers, and it's unequivocally related to cancers such as lung cancer, head and neck cancer, and bladder cancer. Those are the biggies related to smoking. But it can also be related to other cancers you don't think about. One of those is breast cancer. Another is leukemia. Studies have shown that when people stop smoking for 10, 15, 20 years, their rates of developing cancer go down to the levels of people who never started smoking at all. So the good news is if you do smoke, you can actually stop now and it will make a difference in your likelihood of developing cancer. Obesity is a big risk factor for a variety of cancers, including breast cancer and colon cancer. Exercising prevents a number of cancers, lowers the risk of those cancers, and even if people get cancer, if they exercise, it turns out they have better survival than people who don't exercise after a cancer diagnosis. The US Surgeon General last year actually formally listed alcohol as a cause of cancer. And there isn't any one cutoff where if you drink less than this, you won't get cancer, but if you drink more than this, you will get cancer. It's what we refer to as a dose-response relationship. So the more alcohol you drink, the higher your cancer risk. And I think with any lifestyle choice that we make, we have to weigh the benefits, the pleasure from that lifestyle choice and the risks of that lifestyle choice.
It becomes philosophy, life philosophy indeed. Do you suggest a regular checkup?
I do. So I go to my general internist, my primary care doctor, once per year for monitoring of things like cholesterol or blood pressure. For me, as a man who's over the age of 50, I have undergone cancer risk screening. I have undergone a colonoscopy. I have chosen to have my PSA checked, which measures your risk for prostate cancer.
Right.
I live in Florida in the United States. We're a very sunny state. So I also go to a dermatologist every year for a check for skin cancer.
Now about fighting cancer, because we've been talking about preventing cancer or lowering the risk of cancer. Now fighting cancer. Cancer treatment has made a lot of advancements in these years. So would you please explain in simple terms the revolution of cancer treatment?
The earliest cancer treatments actually was surgery. If you can remove the cancer in its entirety, people live longer. Now, that is still the treatment of choice for certain solid tumors. For example, my own mom developed lung cancer. She was a lifelong smoker. Despite my efforts, even as a child when I was in school, to try to get her to stop smoking, she couldn't. She was addicted to nicotine. When she was diagnosed with lung cancer at the age of 74, it was confined to one area of her lung and it could be surgically removed. She's still alive 8 years later. She was lucky. She had an early stage cancer. So surgery is still a great method of treating and often curing cancer. Chemotherapy works and radiation therapy works by killing the cancer cells. Cells, you may recall from school, have a central nucleus, and in it you have genetic material, DNA. And that DNA, that genetic material, has to make a copy of itself for the cell to grow and make a copy of itself. Chemotherapy stops that process of copying the DNA, the genetics of that cell, and kills the cell. The revolution we have seen, particularly in the past 2 decades, has been identifying the biology, the genetics of those cancer cells, and then developing drugs that focus just on those genetics and disrupt how the cell works. And one of the most notorious examples is chronic myeloid leukemia. And we're using targeted therapies more and more in a variety of cancers. And for the first time, we're seeing people with lung cancer, like my own mother, who are living years afterwards because of those targeted therapies. The other breakthrough has been immunotherapy. In other words, taking hold of the immune system and using it to fight the cancer. When our bodies develop those rogue cells that you mentioned earlier, those cancer cells that grow and divide, it's our immune system's job to recognize that they're abnormal cells and pluck them out of our body and get rid of them so cancer doesn't develop. So you can think of cancer development almost as a deficiency of the immune system. So we now give drugs that use the immune system to fight those cancer cells and get rid of them. And in CAR T-cell therapy, we're actually removing cancer cells from a person's body, deliberately growing an immune system to attack those cancer cells and reinfusing it into the person with that new army that fights just those specific cancer cells.
Professor, I know you've accompanied countless patients through their cancer journeys. You've witnessed a lot of struggle and resilience during the process. Would you please share one story with us that impressed you the most?
One patient in particular I met who had a cancer diagnosis. It was an advanced cancer. He was admitted to the hospital because the cancer had come back. And we were about to start therapy when his wife stepped in and said, there's something he really wants to do that he needs to do outside of the hospital. Can we delay the chemotherapy at all, or can he take it as an outpatient? And I asked, well, what is that? And he spoke up and said, well, I have a young daughter who's 5 years old, and we were really hoping to go to a dance tonight. There was a daddy-daughter dance that he wanted to participate in. And as he told this story, I thought back to when my daughter was 5 and we would dance together at a wedding or at an event. And I remembered how she was so little, she would put her feet on top of my feet, right? And I would lift her up, and we would dance together as fathers and daughters often do. So it reminded me, and of course we said to him he could leave the hospital, he could go to the dance. We worked out a way that we could give therapy to him where he didn't have to be in the hospital. It reminded me what's important in life, and how we should always be focused on our friends and family. That's so much more important than our own diagnosis or the work that we go into every single day. Remember, you're not alone. The cancer doesn't define who you are. Remember to ask questions. Never hesitate to ask questions of your healthcare team if there's anything that's confusing. And remember to communicate your goals to your healthcare team so they're choosing the right therapy for you at your stage of life.
Really, really wonderful talking we had just now. Thank you. Well, everyone, the fight against cancer is not just in hospitals. It could be in your kitchen, it could be in your life habits, and it could be in your fridge at midnight. So be careful, watch out for your lifestyle. Take care, everyone. I'm Li Dongning. Thanks for watching. Bye for now.